Workers in the health and social sector were already struggling before COVID. A year on from the start of the pandemic, the situation is far more challenging.
Rates of burnout on those providing essential services are on the rise. Former healthcare CEO and author of The Health Hazard, Alison Coughlan, joins us now. Alison, this is a real problem.
Yeah, absolutely. Absolutely. I would argue very clearly that we had a major health hazard on our hands within at the wellbeing of our health and social sector workers in both direct and indirect roles before the pandemic hit, and that it was not a sustainable situation. We need energy and fuel to burn, and we need to change our routine practices around how we look after ourselves and how we look after our workers in these systems so that we have the capacity to be able to face into these challenges that will inevitably occur in both our work and our personal lives without incredibly damaging personal tolls. So I'm glad that we're having a conversation about it now, and that the impacts of COVID have brought it even more into the spotlight. But we need to do something about this very urgently as individuals, as policymakers, and across the sector.
Well, there are some horrific statistics. So just reading on the front page of one of the pages of the Herald Sun about the violent assaults on frontline police and also firefighters, paramedics. As we know, they just work above and beyond. Some statistics, Alison, last year, 3,492 assaults on police and other emergency service workers. They were recorded in Victoria alone, and that's up 512, or a shocking 17% on last year. So this is just extraordinary.
Yeah, absolutely. And we know that in all of these professions that you've mentioned, in professions where we are looking at trying to relieve suffering, whether that's illness, disadvantage, whether we're facing into emergency-based situations, that we have significant wellbeing impacts and vulnerability to burnout just through going about the course of those roles, the critical roles that we need people to turn up well and in service and with compassion. But we're also, as we're going about those roles, we're facing into conflict and sometimes violence. And of course, we're all human beings. And so we have our work and we have the rest of our life. And the impacts and challenges in our personal life impact our work life and vice versa. And so it can become quite the perfect storm if we're not being proactive about our well-being, about our energy, and if we're not able to restore those reserves so that we are looking after ourselves, so that we can sustain ourselves, but also so that we can do the best work that we possibly can for those that we serve.
Alison, do you think we need a day somewhere in the future, somewhere in the near future, where we say this is a day designated to a day of thanks to people that have worked on the front line through this pandemic? We saw it with volunteers at the Sydney Olympics. We've seen it in various capacities because it's hard enough doing the job, but when you're not appreciated and, you know, everyone's agitated and you do just get that anecdotal sort of stress from people because of that, they don't know what's going on. It's so difficult.
Yeah, I think absolutely. And we know that one of the factors that can contribute to burnout is if people are not feeling heard, seen, valued, understood, if the demands are just relentless and they never let up. And so the norm becomes, completely unsustainable. So I certainly think that's, a terrific concept, Tim, in terms of formally acknowledging this. But I think that we need to step up and make every day a day that we, as people working in these sectors, that the leaders in these sectors, that we recognise that every moment of every day we need to be thinking about our energy and our well-being, how we're replenishing that, what are the things that are draining that, what are the things that are getting in the way, and shift things. Because we get on that hamster wheel and it's relentless and we just keep pedaling, and then those things that keep us well and those things that bring us joy and those things that matter to us in other parts of our life are things that start to fall by the wayside. And so it becomes a vicious cycle and a decline. So it's about a shift in focus to every day How am I feeling? What do I need? If I'm going to turn up in service today, what is it that I need in my fuel tank to do that? And what are the things that might impact on that? And so proactively as individuals focus on our wellbeing within our teams, how we support people and our workplace cultures, and our leaders need to model that. We need self-caring leaders who are role modelling the maintenance of their own wellbeing. Because the problems that we're facing require us to not just get by, but to be innovative and to have energy to burn. And so this concept of running on empty just needs to be fundamentally challenged. We need to consider burnout as a major occupational health and safety issue that we should not accept as the norm, and shift one breath, one moment, one step at a time.
And Alison, you're a former healthcare CEO and also an author. You've experienced burnout yourself. What have you seen individuals and organisations do differently due to COVID?
I think that there's a whole revolution that's happened across all sectors with COVID in terms of, working from home, in terms of in the health sector, the adoption of telehealth, which was something that over many, many years has been a technology that's available, but has been largely resisted in terms of what are our traditional ways of delivering care. So I think there's a whole lot of opportunity around some of the disruption of COVID in terms of balance between work and life, in terms of flexible arrangements around working, around flexible arrangements for even delivering services that can also have an impact on our wellbeing. I think perhaps some moments and some insights into the things that matter to us, that when we were just so busy and not paying attention to those things, COVID sort of helped us to shed a light on that, if you like. And people are starting to say, actually, I don't want things to go back to how they were. So my sense is that we've got a bit of a movement and a shift in the right direction. And we need to make sure that as things settle back to normal, that some of these norms around burnout and relentless busy and a lack of self-care and compassion for others but not ourselves just are rejected as our modus operandi.
Yeah, it's a good message. And look, we see a lot of organisations, because of the lift in anxiety over the last year and a half, have messaging through please treat our staff. We will not condone any poor treatment of our staff. I think that everyone in the community, when we look at the healthcare sector, can play its part. There's frustration in vaccine rollouts and everything else, but we can all play our part. Alison, it's been really nice to chat this morning. Thank you.
Yeah, thank you so much.